Setting: suburban clinic. You see a 60-year-old patient who has rheumatoid arthritis. He is attending an appointment to get information about pneumococcal polysaccharide vaccination, which he has been advised to have. Now, let's look into the task. First one says, confirm the reason for the patient's visit. Second one says, explain the need for vaccination. That is, rheumatoid arthritis. Patients have high risk of pneumococcal infection, compromised immune system. Third one says, stress the importance of immunization against pneumococcal infection, such as pneumonia and septicemia. Fourth one says, give details about the vaccine, that is bacterial, remain same, given every 3 years, etc. and flu viral strain constantly changes, given yearly. Fifth one says, outline possible temporary side effects, slight temperature, redness, swelling at the injection site. Recommend making an appointment with GP if not well. Sixth one says, ask patient about reaction to the flu vaccination, high temperature, muscle ache or fatigue. Seventh one says, reassure patient about having PPV today, no adverse reaction to flu vaccine, suitable interval since earlier vaccine, etc. The last one says, establish patient's consent to have the vaccination. Now, let's start the role play. You can start like, hi, good morning, I'm David, the registered nurse in this suburban clinic. Please be seated. Then interlocutor may respond by saying, good morning, nurse. Thank you. Then ask him, may I know the reason behind your visit? Then interlocutor may respond by saying, nurse, I got a letter from your clinic to have the pneumococcal polysaccharide vaccination. I don't really think that I need this vaccination, so I'm a little confused. So can you please let me know why should I go for it? Then respond him saying, your concerns are understandable. Don't be worried too much. I am here to help you. Okay, may I know your name and age for verification? Then interlocutor may tell you like, nurse, I'm John and I'm 60 years old. Then respond him saying, okay, Mr. John. Yes, I remember that we have sent the letter because you have rheumatoid arthritis. Then interlocutor may ask you, nurse, I don't really understand. Why should I take it? Then respond him saying, okay, Mr. John, let me explain you why this vaccination is important for you. The vaccination which we recommend for you is pneumococcal polysaccharide vaccination. The vaccination is also known as PPV vaccine. We advise this vaccine for patients who have rheumatoid arthritis due to their compromised immune system and they are at high risk of pneumococcal infection. Additionally, it provides protection against pneumococcal infections because these patients are vulnerable to disease conditions like pneumonia and septicemia. So, in order to protect you from these complications, we recommend you the PPV. Are you following me, Mr. John? Then interlocutor may respond by saying, nurse, I understand that. However, usually I take the annual flu vaccination. Because of this, I thought I would get adequate protection. Then respond him saying, your thoughts are reasonable, Mr. John. However, this is a different vaccination, that is PPV. Don't worry, let me explain you that in detail so that you will get a better understanding. Then interlocutor may agree with that. Then continue by saying, first of all, let me explain to you what the flu vaccine is. Basically, it is a type of vaccine against the virus influenza. Flu vaccine is a type of vaccine against the influenza virus that causes seasonal flu. It is also known as flu jab or flu shot. It protects people from infections caused by influenza viruses. However, pneumococcal vaccine is a type of vaccine against bacteria, Staphylococcus pneumonia. PPV vaccine can prevent pneumonia, meningitis, and septicemia. Therefore, PPV can prevent pneumococcal disease. This bacteria can cause many types of illnesses, including pneumonia. As you know, this is an infection of the lungs. Pneumococcal bacteria are one of the most common causes of pneumonia and which is given once in every 3 years. There is a difference in flu vaccine because the strains constantly changes. I hope we are clear now. Then interlocutor may respond to saying, okay, nurse, I got an idea now. But may I know if there are any kinds of side effects for this vaccination? Then respond to him saying, acknowledge your concerns, Mr. John. Yes, after the vaccination, you may experience temporary mild side effects like swelling or redness at the injection site and mild temperature. But don't be overly concerned. These are temporary and it will disappear within few hours. In case if the side effects persist or if you feel unwell, I would recommend you to make an appointment with your general practitioner so that he will provide you for the management. I hope you're following me, Mr. John. Then interlocutor may agree with that. Then continue by saying, I'm happy to hear that, Mr. John. By the way, I would also like to know if you have any reaction to the vaccination like high temperature, fatigue or muscle ache. Then interlocutor may tell you like, Nurse, fortunately, I did not get any reaction after the flu vaccination. I would like to let you know that I have taken flu vaccination 2 months ago. So do you think is it the right time for another vaccine or do you want me to wait a little more? Then respond him saying, your worries are completely understandable, Mr. John. There is nothing to be alarmed about taking vaccine today because if you take PPV, there won't be any adverse reaction to the flu vaccine. Apart from that, you have taken the flu vaccination 2 months ago. Therefore, a 2-month interval is good enough to administer PPV. How does it sound, Mr. John? Then interlocutor may tell you like, that sounds really great, nurse. Then continue by saying, thank you, Mr. John. Do you have any more concerns regarding vaccination? Then interlocutor may tell you like, no, nurse, you can proceed to take the vaccination now. Then respond to him saying, I appreciate your decision, Mr. John. I can also provide you a detailed leaflet which contains complete information regarding PPV. So kindly go through it so that you'll get a better idea. Okay, Mr. John, can I have your consent to administer the vaccination? Then interlocutor may agree with that. Then you can just wind up the roleplay by saying, okay, Mr. John, I hope I have clarified all the concerns regarding the polysaccharide vaccination. I hope you understand that. You please be seated here. I'm going to prepare the vaccination for you. It may take a couple of minutes. In between, if you have any questions or concern, you can just let me know. I'll be happy to help you. So thank you, Mr. John, for your visit. I wish you a great day ahead. Thank you, guys. Our roleplay ends here.